So this is a phase 1 study of the IDH2 inhibitor Enasidenib, and it's a very large study. It started as a dose escalation study, and then it morphed into 4 expansion arms. 2 of those expansion arms were for patients with relapsed and refractory AML, 1 for patients with untreated AML, and 1 for patients who didn't fall into one of the first 3 buckets. So what we're presenting here today is the safety and efficacy data for patients with relapsed and refractory AML, both in the dose escalation and in the top 2 arms of the dose expansion study. So number 1, the drug I think is extraordinarily safe. There really hasn't been any evidence of significant toxicity at all. It's oral, so it's very easy for patients to take. And I think more importantly, it appears to be quite effective in patients with relapsed and refractory acute myeloid leukemia, which, as you know, really has a very, very poor prognosis. So the overall response rate with this drug in patients with relapsed and refractory AML is 40%. The complete remission rate is 20%. And what that translates into is a median overall survival of 9.3 months in the entire patient population. But for those patients who achieved a complete remission, the median overall survival is over a year and a half. It's 19.7 months.